In 2015, 17 million people died from cardiovascular disease globally. That's our best estimate. That's one death almost every 2 seconds. And roughly 80% of those occur in developing countries. There's a large potential for cardiovascular disease prevention globally through simple means by quitting smoking, by improving diet and lifestyle, like increasing physical activity. The Lown Scholars Program is hosted by the Harvard T.H.Chan School of Public Health, and the idea is to train a new cadre of people and public health professionals specifically that would help prevent cardiovascular disease in the developing countries.
My name is Bongani Mayosi. I'm a senior scholar in the Lown Cardiovascular Program in the Harvard School of Public Health, and I am the Dean-elect at the University of Cape Town.
The main aim of the program is to prevent cardiovascular disease and improve cardiovascular health in developing countries. And we encourage and insist our scholars do that by attacking the root causes of those problems. And these are usually social, economic, and cultural issues that lie at the heart of the cardiovascular disease epidemic. Main themes of the program in 2016 are cardiovascular health in the urban poor, universal primary health care, health disparities, and psychosocial stress.
My scientific work and research has been concerned about poverty-related heart diseases and the genetics of cardiac problems. In terms of poverty-related heart diseases, it has been about reducing the burden of pericardial tuberculosis, rheumatic heart disease, and the cardiomyopathies. People contract these conditions needlessly because they are entirely preventable. This is what has inspired me to dedicate my life to working on these problems. The opportunity for me to work with the Lown's program is an exciting one because it is the premier program for the prevention of cardiovascular disease in the world. I will have an opportunity to work with some of the best minds in the world on cardiovascular disease here at Harvard, but not only that, the opportunity to consider developing sites of excellence in Africa to train a new generation of investigators to stop rheumatic heart disease and other forms of cardiovascular disease on our continent.
My name is Olabimpe Ruth Essay, and I'm a junior scholar at the Lown Scholar Program. I also coordinate nutrition studies at the Institute of Human Virology in Nigeria, where we're trying to see how to incorporate healthier options in the Nigerian diet, moving from high glycemic index food to foods that have low glycemic index and foods that have more fiber and lots of nutrients. The Lown Scholars Program has been very helpful in different aspects, in mentoring, in training, in finance, and I think these are one of the major things that are necessary and that are needed back in Africa. So in mentoring, I've been able to rub minds with really important scholars and people who know the good behind the science, and I've learned a lot in this time, and I think that has made tremendous impact in my career.
The Lown Scholars strive to improve the cardiovascular health in developing countries through combining two major roles. As scientists, they are pioneers in developing new knowledge and really answering the question, how can we prevent cardiovascular disease in each specific setting? But more importantly, as public health professionals, they embody the social responsibility aspect of Professor Lown's work to design programs that help those who are in most need in their communities and in their countries.